Just in the whip's office, do you have the votes to pass health care?
We are ready to go to the floor and pass it.
Now, you were in there with the President's Chief of Staff, Reince Priebus.
Yes.
How has the White House worked with you in order to push this over the deadline?
They've been great. They've made phone calls. They've talked with members. They've worked with us as we've tried to get the answers that people needed, making changes in the bill, making additions, improving it, making certain, first of all, that we keep our focus on patient-centered health care. That's the goal of this. We tried government-delivered health care, and it does not work. So I give my colleagues a lot of credit and the American people for realizing this doesn't work. It's too expensive to afford, too expensive to use, and we need to do something different.
Let me ask you one final question. Sure. Is the issue of pre-existing conditions adequately settled with Representative Upton's amendment? And secondly, are you concerned that this was not scored by the budget office?
A couple of things there. Is it adequately settled? Yes, it is. And bear in mind, all of this on pre-existing conditions started back in 2006 with a Republican bill. We've been on how to do this properly and how to do it so the change is lasting. And the way they did it with Obamacare, with the essential benefits, did not work. And we know there has to be a different way that is going to be more affordable and lasting. That's what we've done. Scoring by the CBO, I think when it comes to health care, we look at what happened with the Affordable Care Act scoring. They were off by millions. They thought there would be over 20 million people in the pool by now, and the cost would be down over $2,500 per family. There are 9 million people in the pool, and costs have escalated 114%, 63% in my state of Tennessee. The rate escalation on insurance has been very difficult, and the networks have narrowed considerably.
And last question for you. How far away are we from a vote? And also, are you concerned that it'll change significantly when it's in the Senate?
I think the Senate is going to appreciate the product that we send to them. I do not think you're going to see substantial changes in the Senate. I think you'll see continued engagement by the White House.
And how far